Causes of ulcers in young children. So primarily the main cause of ulcers in young children is Helicobacter pylori, that's H. pylori. Yeah? So, but there are also other causes of ulcers in young children, like how we are going to talk about them. Yeah? So among those other causes of ulcers in young children, we have family history of ulcers. So if your family has genetic predisposition, yeah, this one can make your child prone to getting ulcers. Yeah? So we can also talk about excess stomach acids. So if your child has conditions that cause overproduction of stomach acid, e.g. Zollinger-Ellison syndrome, yeah, so that one can also increase the risk of your child getting ulcers. So we can also talk about poor eating habits in children. So if your child skips meals or has irregular eating patterns or consumes spicy or acidic foods or eats junk foods, so those ones can irritate the stomach lining of the child and also increase the risk of getting ulcers. Yeah? So we can also talk about infections in children, like serious infections in children. So some of those severe infections in children, yeah, can weaken the immune system. Yeah? That's disrupting the stomach lining, and that's also leading to ulcers in young children. So you can also talk about substance exposure in young children. So if the child is exposed to caffeine, carbonated drinks, or smoking, yeah, it can include also second-hand smoking, yeah, so that one can also expose your child to getting ulcers. We can also talk about stress. So if your child has stress like emotional or mental stress from school or peer pressure, family issues, or academic performance, this one can also increase the ulcers. It can also increase ulcers in young children. Yeah, so because stress also leads to increased production of acid in the stomach. Yeah, so how can we prevent ulcers in young children? So the first way of preventing ulcers in young children is that ensure that your child eats a regular balanced diet. Yeah, a regular balanced diet is very important to prevent ulcers in young children. Like your child should not skip meals, and the child should also eat a balanced diet. Yeah? So we can also talk about limiting the use of NSAIDs and also consulting a doctor for alternatives. So if you've been using NSAIDs, like if you've been giving your child NSAIDs, so you should limit the use of those NSAIDs. And also you should talk to the doctor so that they can give you alternative drugs. Yeah? We can also talk about maintaining proper hygiene, yeah? Like at your home, to avoid your child from getting H. pylori infection. Yeah? So as we said like in our first statements that H. pylori is the major cause of ulcers in young children. So you can also talk about teaching stress management techniques to your child. I know